Hi, Stephanie Wagner here with WisCare Insurance Agency. Thank you for watching this video in preparation of our meeting. We will discuss what is Medicare, the difference between original Medicare and Medicare Advantage, as well as talking about what to expect at our meeting. So let's dive into it. What is Medicare? You might have some kind of idea. Medicare is a federal health insurance program for people that are 65 plus, some young people with disabilities, as well as people with end-stage renal disease. There are different parts of Medicare. Part A, which is related to hospital. Part B, which is related to doctor's visits, outpatient visits, and then Medicare D, as in drugs, which is related to drugs. Parts of Medicare, original Medicare, that is what you will be signing up for. Medicare Part A for hospitals, that is typically a zero premium. And the reason is you've been probably paying into it if you've been working. If you or your spouse have been working for 10 years or more, then you will not have to pay a Part A hospital premium. Part B does have a premium that everyone will pay. In 2024, that premium is $174.70. Now, if you are making a certain amount of money or above a certain threshold, you will be paying an IRMA, which is an income-related monthly adjustment amount. So that Part B premium, you might be paying more than that $174.70. Keep that in mind. Part D for drugs, you could potentially have a premium, not have a premium. It just depends on the drug plan that you choose. If you do have an IRMA for Part B, you will also have an IRMA for Part D, as in drugs. And that information we will discuss more. I will give you the income brackets as well as the income-related monthly adjustment amounts for those income brackets. We can figure out what that IRMA would be if indeed you do have one. So again, original Medicare, there's Part A, Part B. Now, Medicare does not cover all costs. We are not going to get into the details of all the costs. It would take too long, but just know that Medicare does not cover all the costs. They cover some of the costs. That's why we have a meeting coming up, is to talk about your options. So those options are keeping original Medicare and choosing a Medigap, also known as a supplement plan, to cover the additional health costs. And with that supplement plan and original Medicare, you will need a separate Part D drug plan. I like to think about the first path, let's call it option one. This is the a la carte path, I like to say. So that's option one. Option two would be going down the Medicare Advantage path. Is a little bit different. You are no longer an original Medicare. What it is private companies say, hey, Medicare, you pay us a certain amount of money and we will manage the care for these people. Medicare does regulate these plans, so there are guidelines, but you can think of option two, the Medicare Advantage route, as being somewhat similar to what you're used to, like an employer plan, because there are networks. Some of these plans do allow for out-of-network options, but for the most part, you have a network. If you go in-network, your costs will be less. If you go out of network, typically, not always, your costs will be more. Often they are more. So two different options. That is Medicare in a nutshell. What we're going to talk about now is the difference between original Medicare with a supplement plan versus option two, which was the Medicare Advantage plan, which rolls everything into one. It's the Part A, Part B, and Part D, often, not always, with the drug plan, and they call it Part C. So sometimes you will hear Medicare Advantage be referred to as Part C. The difference between the two, again, we're doing a quick summary here. There's not enough time to really go into all the details, but that's why we will meet either face-to-face or over the phone. The main differences between the two are option 1, original Medicare, plus the supplement plan, and a Part D plan. With original Medicare, you can go to any doctor, any hospital in the US that accepts Medicare. So that is a huge thing to consider, is what do you want in your healthcare needs? Do you want that option? So if you had, for example, some rare disease and you wanted to go to MD Anderson because they specialized in it, or Johns Hopkins, you can do that with original Medicare and a supplement plan. You cannot do that with an Advantage plan with the networks. Typically, if you have a supplement plan, here in Wisconsin, we have a basic plan plus riders. If you had the basic plan plus the riders, you would see a higher premium. However, you wouldn't see very many costs. If you have the plan and your effective date was after January 1st of 2020, then you would have to pay the Part B deductible, which in 2024 is $240. Other than that, most of your costs would be covered. So think of it this way: you pay a higher amount up front, and on the back end, you're not going to see much, if any, healthcare costs. Whereas the Advantage plan, typically there are low premiums or zero premiums involved, but you have co-payments, co-insurance, and maximum out-of-pockets. So if you do utilize the plan, you're going to start having to pay. This is the hard part of deciding what's right for me, original Medicare with a supplement plan or an Advantage plan, because we cannot predict the future. If we could, I could tell you exactly what plan would save you the most money, but that is not the case. So what we want to think about here is, what do I want for my healthcare options? What do I want to be able to see any doctor, go to any hospital? Do I want that convenience, or am I okay with a network of doctors and hospitals locally, and okay with it potentially changing, or my doctor or specialist going out of network? It's just certain things to think about. There's some other differences between the option 1 supplement plan with original Medicare and option 2 an Advantage plan would be medically qualifying. So in your initial enrollment period, which is when you first become Medicare eligible, you're soon to be turning 65. You have the 3 months prior to your birthday month, your birthday month, and the 3 months after to enroll in Medicare and make your choices on option 1 or option 2. In this initial enrollment period, you can choose option 1 or option 2 without any medical underwriting. So you can choose a supplement plan or the Medicare Advantage plan, no medical underwriting. Once you go outside of that initial enrollment period, and if you don't qualify for a special enrollment period or any guarantee issue, you would have to medically qualify for option 1 for the Medicare supplement plan / Medigap plan. Medicare Advantage plans are different. During your different enrollment periods, initial enrollment period, annual enrollment period, general enrollment periods, the different enrollment periods that you are allowed to either change plans or sign up for Medicare Advantage plans, and there's no medical underwriting ever in those plans. So that's huge. You want to think, okay, what is my health history? If I choose an Advantage plan and there's a potential that I want to go back to original Medicare with a supplement plan, I may have to medically qualify if I'm not in a qualified period or within my initial enrollment period. So again, things to think about. Now for Medicare Part D. I did mention earlier that Medicare Part D covers drugs. It is a separate drug plan that you would need to purchase with traditional Medicare or original Medicare in a supplement plan. Option 2, the Medicare Advantage plan, often has prescription drug plans within the plan. So those would be called MAPDs, Medicare Advantage prescription drug plans. Some Advantage plans do not have drug plans. You will want to make sure you have a drug plan, and the reason is there could be penalties for not enrolling in a drug plan when you're supposed to. Again, these are all things we will discuss a little bit more in our meeting. Also, one other thing to mention, difference between original Medicare with a supplement plan and a Medicare Advantage plan, the perks. Okay, so during annual enrollment period, October 15th to December 7th, you are probably seeing a lot of commercials. You might be receiving phone calls, for sure a lot of what we call junk mail or pamphlets in the mail about Medicare supplement plans, Advantage plans, mostly Advantage plans you're going to see. And a lot of these plans talk about zero premiums, and we give money back, and we have free dental, vision, hearing. So yes, there are some really great perks with a Medicare Advantage plan, but I always tell my clients, first and foremost, think about your health and your health care. What is it you want to see? Then if the path you take does offer these extra added value, great. But first you want to think about your health care needs. What if something happens? What do I want available to me? How do I want to pay for things, etc. So what to expect in our meeting. We'll briefly go over this video. I will answer any additional questions you might have. We'll dive into the costs of going down path 1 or option 1, original Medicare with a supplement plan and a Part D plan. So we'll talk about what costs are involved. And path 2 or option 2, Medicare Advantage. Thank you again for watching this video. I look forward to meeting with you and talking with you. If you have any questions in the meantime, feel free to reach out to me. You can call me 262-366-3230. Send me an email at steph@wiscareins.com. You can also visit my website, which is wiscareins.com, and I do have additional videos. Again, we will discuss many of these things in our meetings, but this just helps you get started. So thanks so much. Take care. We'll see you soon. Bye.